when I think about chronic compartment syndrome and I think about the client that I had, they would have done this fasciotomy and then sent him right back to sitting in a car all day, shortening those tissues, and then leaning forward and putting his weight in the front of his feet, turning on all that tension in his body. The main message that I want to put out there with this is that educating clients about these other things and perhaps also educating the referral sources, educating the providers that are helping a client make the decision between a fasciotomy versus a conservative approach, because once you cut, you can't go back. Welcome to the Fascia-Informed Therapist podcast, designed for health and wellness practitioners interested in fascia science. I'm Amy Mayer, occupational therapist, practice owner, author, and educator with more than 30 years of experience using fascia techniques across many settings. Each episode brings practical insights and thought-provoking conversations to help you expand your skills and better serve your clients. Let's get started. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. If you've been listening for a while, you know that frequently my topics are whatever is coming up in my practice or popping up in my brain as something that sounds interesting, or I'm responding to something that is going on in the world, or it could be about anything. But there's not maybe a lot of rhyme and reason to what I do. I tend to follow my energy and my interests. So this week is on compartment syndrome. And the reason that I chose this is because I had two friends of mine, not clients, friends, who asked me about it because they were both concerned that it might be something that they needed to explore further. One friend had a knee replacement. Both these men are in their 50s. One had a knee replacement, ended up with a hematoma on the back of his knee, and was not told he had compartment syndrome, but his own research led him to be concerned that he might have it. I have not circled back to talk with either one of these people since I've been out of town to find out, did they go seek more medical help and get an answer? I know both are regularly engaged with their medical professionals. So, but yes, I thought I told them if they really think they have that, yes, they need to go get it checked out. So the other person had a major medical event a few months ago and has completely rethought his engagement with exercise in order to make him a healthier person, and had some pain in his calves. And so that was something that he came across in his own exploration on the internet to sort of sort out what might be going on. And both these people are very intelligent people and can draw reasonable conclusions about what they're reading and how it applies to them, and then what they should do next. Now, my interest or engagement or exposure with compartment syndrome happened several years ago when I was probably earlier in my recent full-time practice. I had a dad of a client who actually is from out of town. If I know some of you listening may not know exactly where these cities are, but he actually is in Kansas City, and that's about 3 hours away from Omaha. And someone had told him about me, which I thought was very strange in Kansas City. But the person that told him was a traveling, that's a weird term, traveling salesman. They were did sales, but they traveled all over the region. That sounds more current. Anyway, the dad had heard about me, and his son was actually living in Omaha and was a collegiate athlete, and he had a long-term problems with his knees that nobody could seem to figure out, despite all the high-level professionals they had him going to as a collegiate athlete. So Dad really felt like he had a lot of tension in his legs, and that was probably part of it, and the typical things they were doing for him were not working. So he wanted to try fascia work. We talked on the phone quite a bit, and his son ended up coming to see me, and we were able to figure it out. And he ended up being back in his sport and doing well, and haven't heard from them in a long time, but that was a pretty cool thing. So after working with the son, the dad says, hey, you know what? Maybe you could help me. And I'm like, well, tell me what's going on and we'll see. And he said, I'm told I have something called compartment syndrome, and they want to do something called a fasciotomy. And when I heard him say fasciotomy, I was like, whoa. I mean, in my mind, a fasciotomy was like extreme. And if you don't know what a fasciotomy is, that is where they basically take the area, the compartment or the area where the problem is happening, and they do basically a longitudinal cut above, through, and below that particular compartment, and they open it up and they try to take out anything that they think is blocking the way, essentially. And so it's pretty, I don't know, the word barbaric comes to mind, but it's just a pretty major, intense kind of a surgery. And I asked him, oh, wow, this must be serious if they're jumping to that. What else have you tried? What else have they suggested that you do? And he said, well, nothing. So they never offered this man any conservative options. They just said, okay, based on what we see happening, then we suggest you do a fasciotomy. But yet this fasciotomy wasn't scheduled for over a month. And so, which also led me to believe, or to ask more questions about, okay, this must not be an acute problem. Tell me more about the problem. Because if you're experiencing acute compartment syndrome, you need to have surgery right away, and we'll talk more about that. But what he was experiencing was more of what they would call chronic or exertional, or sometimes chronic exertional compartment syndrome. And he explained to me how he was a runner. And he had been not a super intense runner even, but it was more just his form of exercise. And he and his wife liked to run together as a way of staying in shape and healthy. And he began to experience pain in his calves after they would run. And over, several minutes, hours after they would run, it would go away. But in the meantime, he would have this, it slowly got worse and more intense pain after he would run. And then it affected his ability to run at all. And wife continued to run, but then he started walking instead. And then he would experience it with walking. And he said it wasn't as bad, but I would get that. He said it would feel like my calves would get full and tight and painful. And then that would slowly dissipate over time. And when I say time, I mean minutes, hours after he was done walking. And he said they did some tests and that's part of the diagnosis of compartment syndrome, is where they do a pressure test. He said they had done that. They didn't see a lot of pressure unless he had done exercise. And then they would see the pressure, but then it would go away. So I explained to him, I said, I don't know a lot about compartment syndrome, but let's talk about what's happening when you run or you walk, and you're using muscles that you're more intensively than when you're moving around all day. And fluid has to come in, blood has to flow in, and then the muscles produce their waste, and then the fluid needs to flow out. I said, what it sounds like is the fluid's not flowing out. And then I also, because I knew him a little bit from talking, and I said, now you also have told me that two major things when we think about somebody's habits, somebody's life habits, and how they feed into a problem. So I knew that he also was a medical salesperson, and he spends most of his time in two places. One is the car. So he's in that bent knee position for long periods of time. And then he was also standing in the surgical suite, like sort of looking over the shoulder of what's going on, helping the new medical devices, sort of walking them through the different pieces and parts and how they're using them, and sort of being there in the surgical suite to help out. And in my mind, I'm seeing when he's saying, looking over the shoulder, trying to see what's going on, I'm imagining him leaning forward into the front part of the foot in order to lean forward. And what happens when you do that? Your calves have to really kick in. The back part of your legs and your hips really have to kick in and tighten up to hold your body in this forward leaning position. So I'm imagining how tight his legs probably are and his hips. And so I said, well, I'm imagining how tight you probably are. And if you think about what's going on, all this fluid's flowing in, but it can't flow out. And I explained to him a little bit about the lymphatic system and how tension in the fascia can actually block that. And some of the articles, they say, the garden hose, a kink in a garden hose, so things can't flow the way they're supposed to. So I explained all that to him, and he's like, well, that makes really perfect sense. And I said, I would encourage you to maybe, if you want to come to Omaha, I'm happy to work with you to see if we can soften some things up. I would love to see you take more breaks when you're driving. I would love to see you maybe if you can get closer to what's going on in the surgical suite so you don't have to put so much weight forward in your feet and lean so much. If you can start changing some of those habits and then also do some fascia work on your legs, some more stretching. I taught him how to use the therapy balls to self-treat, and he agreed to try that for a while and then decide if he was going to still do the surgery. And he ended up, everything that I taught him helped him feel better, and he wasn't having the intense problem. And he decided to cancel the surgery. And then, of course, son got better. I actually saw his other son too. And then I haven't heard from them in a very long time. So I don't know what he ended up doing, but I know that he also thought that surgery sounded very scary. It's a pretty intense, and we're going to talk a little bit more about that because I found a study that talks about that as well. So let's go back to what is compartment syndrome, and this is a little piece from the Cleveland Clinic, and it matches up very well with some of the studies that I found. Compartment syndrome is when pressure builds up inside a muscle compartment, usually in the arms or legs, leading to decreased blood flow and potential damage to muscles and nerves. The fascia, which wraps the muscles, and I don't like this, but it says doesn't stretch. Now, fascia does stretch, but in the case of compartment syndrome, it's not stretching the way it should. So swelling or bleeding causes increased pressure inside this closed space. I just thought the way they say it would lead the public to believe that your fascia is not stretchy. Compartment syndrome happens when swelling or bleeding creates too much pressure inside the muscle sleeve. Now, that also makes it sound like fascia is a wrapping when that's really not what it is, but squeezing the blood vessels and nerves. This stops oxygen nutrients from reaching muscles and can quickly cause serious harm if untreated. A compartment is the medical term for a group of muscles, nerves, or blood vessels. Compartments are covered by fascia. And again, I'm going to pause periodically to insert but compartments they're covered by fascia, but we know that fascia weaves around everything. And it's not this, it's not like a balloon and covers everything. Compartment syndrome happens when extra pressure builds up inside a compartment and your muscles press against the fascia more than they should. Compartment syndrome can happen to any muscle group, but it's most common in the legs, especially the lower legs, and that's what I was hearing from my friends and this former client. It can happen in the arms, including the hands and wrists. It can happen in the feet. It can happen in the abdomen, and it can happen in the buttocks. Now, I referred to earlier, there's acute compartment syndrome. This is a medical emergency, and this often happens after severe injuries or can be a surgery complication. And it can cause a lot of problems or even death, depending on where it's happening in the body. And I read in another resource that I can't remember now, I looked at a lot of things, that crush injuries often lead to acute compartment syndrome. So chronic compartment syndrome happens over time when you exercise too hard or too often, and often referred to as exertional compartment syndrome. So I looked at how common is it. Fewer than 10 in every 100,000 people in the United States experience acute compartment syndrome each year. And another just interesting little tidbit that it can be more common in people who have broken their tibia. Interesting. So Stat Pearls, a resource, talks about the symptoms. You might see visible bulging or swelling around a muscle pain, which is more than the usual soreness you'd feel after activity, a sensation of tightness, severe pain when stretching, can be numbness, there can be tingling, or a burning feeling under the skin, and it might feel like your muscle is fuller, firmer, or bigger than usual. So the exertional compartment syndrome happens when there's some kind of repeated stress, much like the story of my client who was running. And when I imagine, I know roughly where they live, so I'm imagining all this running is also going to be on a hard, flat concrete surface, most likely. Okay, let's talk about, chronic compartment syndrome or exertional compartment syndrome usually builds up over time. Frequent, intense exercise is the most common cause. Doing the same kind of workout or training can put repeated stress on the same muscle and cause pressure buildup. They talk about running, as in my client, biking, which is something that my friend was doing a lot of, swimming, which surprised me a little bit, and then weightlifting. That does not surprise me. It's less common, but doing repetitive motion at work or for a hobby can also cause chronic compartment syndrome. And I know a lot of people who do a lot of things like crocheting and then complain about feeling swollen. So reading through all this stuff and re-looking at all this has sort of made me a little more on the alert. And I don't know in that particular case where it's mild that I might do anything different, but maybe just more on the alert and probably and would be very, very, very good if it is a compartment syndrome issue to find it early and deal with it early. I also looked in the book Fascia in Sport and Movement, and that is edited by Schleep and Wilkie. Also a very good book if you lean towards your interest in sports. I would highly recommend that. They talked about compartment syndrome pretty briefly in the book, but they talked about if you're someone who transitions too quickly into barefoot running or minimal footwear running, that can lead to compartment syndrome. They also mentioned in the book that doing short, intense boot camp style training can also propagate compartment syndrome. So another thing to be aware, because the boot camp style classes are something that I still hear about in Omaha. Nothing I've ever participated in myself, but they are out there. So that might be something to give your clients a heads up if they're participating in those sorts of things. How it's diagnosed is often a pressure test where they actually insert something in the area and measure the pressure. I would hope if it's a chronic that they're not just measuring the pressure at rest, but asking the client to do some sort of similar type of exercise that they would do to look for that as well. And then they're also checking for fractures. Now, the treatment. The articles that I found that talk about treatment, if it's acute, it's got to be a fasciotomy because you can't take the time to soften everything up. You're going to more likely get some sort of tissue damage in the meantime. So you've got to go in there, release the pressure from a surgical perspective. And that, of course, makes total sense. If it's exertional or the chronic, then the articles that I found talked about anti-inflammatory medications, varying your exercise routine. I think this is incredibly important. I've been doing more evaluations now that the book is done again, and even people that like to exercise are not stretching. They're not taking the time to keep their body flexible, and they're doing often the same kinds of exercise over and over and over and over. The other recommendation was to improve your flexibility. And then one of them was orthotics. I put some question marks by that because I wasn't exactly sure how orthotics would help other than maybe keeping things in better alignment. Gait training was also mentioned, so giving people better form and if they are running or walking. And then another was Botox, which was interesting. And then under the exertional chronic compartment syndrome, also fasciotomy was listed. And that would be the case of the client I was talking about earlier. They just jumped right to that without giving any other. Now, many of you, if you're listening and are interested in myofascial work, then I found no studies that talked about myofascial work and compartment syndrome. There's no studies out there that I could find in PubMed or elsewhere that talked about that. So if you can find one, please let me know. I would be very curious. I think it's definitely worth it. And of course, I've seen the improvement that it can provide a client and my own. And remember that evidence-based evidence-based work also includes the experience of the clinician. So, my experience with that is valid. But I think it's also my responsibility to know the difference between acute and chronic and the different signs and telling your clients about the differences and giving them their own opportunity to decide what they're going to do. So the first study that I wanted to go over is a 2024 study, and it's called Outcomes of Fasciotomy versus Conservative Management for Chronic Exertional Compartment Syndrome, a systematic review and meta-analysis. And this is in a journal called Cureus, Cureus. So let's see, they looked at compare the effectiveness of surgical fasciotomy and conservative management for chronic exertional compartment syndrome. Okay, so we're not talking about the acute here, we're talking about the chronic exertional. Let's see, 4 studies met their inclusion criteria, comprising both retrospective and prospective cohort designs. The primary outcomes were pain reduction, return to activity, and functional recovery. Secondary outcomes included complication rates and patient satisfaction. Surgical fasciotomy, we're talking about chronic exertional. Surgical fasciotomy demonstrated significantly greater pain reduction compared to conservative management. Patient satisfaction was also significantly higher in the surgical group. However, no significant difference was observed in return to activity rates between those two. Complications associated with fasciotomy included hematomas, nerve injuries, scar-related issues, while conservative treatment showed moderate effectiveness in milder cases. Surgical fasciotomy, and their conclusion here, surgical fasciotomy offers superior pain relief and higher patient satisfaction compared to conservative management for chronic exertional compartment syndrome. However, the evidence for return to activity rates remains inconsistent. Future research, of course, should focus on randomized controlled trials and standardized outcome measures to refine treatment strategies. So I found that to be interesting, that the surgical was greater pain reduction and higher patient satisfaction. I wonder if that's, I just want this problem solved, and people will turn to that because it has a greater chance of reducing the pain sooner rather than taking that slow and steady approach to doing it. This also makes me wonder about, I remember a time when I had a client, and he was just a young guy. Gosh, he was probably in his 20s, late 20s, and he came in because he had his wrists done for carpal tunnel. He had one wrist done, and then he ended up having to have the second wrist done, and now he was having pain in both again. And no one had ever spoken the word ergonomics to this young guy. They just did the release and then sent him back in to do the same work that he was doing before. When I think about chronic compartment syndrome and I think about the client that I had, they would have done this fasciotomy and then sent him right back to sitting in a car all day, shortening those tissues, and then leaning forward and putting his weight in the front of his feet, turning on all that tension in his body. The main message that I want to put out there with this is that educating clients about these other things, and perhaps also educating the referral sources, educating the providers that are helping a client make the decision between a fasciotomy versus a conservative approach, because once you cut, you can't go back. And sometimes your outcomes might be absolutely stellar, but if you're a person who's already prone to greater tension, more scarring, then it could potentially make matters worse. This episode of the Fascia-Informed Therapist is brought to you by me. I offer Fascia-Informed CE for health and wellness practitioners both online and in person. Whether you're looking for flexible self-paced courses or hands-on in-person workshops, you'll find evidence-based practical tools you can apply right away in your practice. Visit Fascia-Informed.com to explore upcoming offerings and take your next step as a Fascia-Informed therapist. Now back to the podcast. So I want to talk about one more study where are we on time? We're sneaking up on 30 minutes. Okay, so this was a study that was 2023, post-operative rehabilitation of compartment syndrome following fasciotomy. And this was in the Turkish Journal of Physical Medicine and Rehabilitation. And let's see, I was going to pull this up. Hang on just a second. Okay, because I highlighted some things. Fasciotomy of the affected extremity segment in the early stages of compartment syndrome is the gold standard in the treatment of crush injury. Now, they talk about more than crush injuries in this particular study. Chronic exertional compartment syndrome is a rare diagnosis among athletes. The typical presentation is seen in running athletes who have recurrent anterior, posterior, or lateral leg pain with repetitive physical activity, and alleviation of symptoms with rest. It most often occurs following a fracture or a crush injury to the extremity. And then it says, due to the non-elastic nature of muscle fascia, this accumulation of mass leads to an increased pressure within the compartment. Which is transmitted to the thin-walled venous system, causing venous hypertension and further transdutation of fluid. I hope I said that correctly. Anyway, they talk about, here's where they talk about what the surgery is. And I kind of described it earlier. Fasciotomy, by definition, is the surgical incision of the skin and the underlying deep fascia of an extremity. There are several important aspects of this relatively simple intervention. First of all, the fasciotomy incision must extend the full length of the affected segment in a longitudinal fashion. And I don't know, but it's simple, but there's a lot going on in there. And then they talk about the rehabilitation after the fasciotomy, which sounds like a very long and intensive process. So when we go back to thinking about fasciotomy, maybe is the quicker, easier way to get this taken care of, it's not a quick and easy recovery. And they do talk about mobilization of soft tissues, but they don't talk about it in any depth in this particular study. They talk about, the areas that they are recommending be covered in the rehabilitation: range of motion and soft tissue mobility, sensory re-education, stretching, that they don't say specifically how, but we know fascia needs that long, slow, gentle stretch, neurodynamic mobilizations, and strengthening. And they talk about phase 1, 2, 3, and 4. But phase 4 is 8 to 12 weeks following surgery. And so to me, that is a very long recovery time for a surgery. When you think about, well, what could maybe you have done in 8 to 12 weeks in terms of something conservative? Now, of course, everybody gets their choice and their decision on what they choose to do, and a lot of things can go into that, including things like insurance coverage and all that kind of stuff. So people have to make their own individual decisions. But what I'm hoping is, now that you know a little bit more maybe than you did before, as always, like I said earlier, if you've found anything else that might be helpful, I'd be happy to touch back on that. Send it to me and I'd be happy to touch back on it on another episode. I will say that I did find some other articles that I want to talk about maybe in another episode, but as I'm looking around and I'm trying to find a little bit more about what is actually happening, I found this great study on, it's a 2021 study in the Frontiers in Pain Research, which is out of Switzerland, and it's called Impaired Lymphatic Drainage and Interstitial Inflammatory Stasis in Chronic Musculoskeletal and Idiopathic Pain Syndromes, Exploring a Novel Mechanism. So isn't that interesting? It sounds similar to what is happening in compartment syndrome, but here they actually talk a whole lot more about the fascia and the lymphatic system. So maybe we'll talk about that next time. And then also, when I was reading through that, they were talking about, let me scroll down here quick. They were talking about the osteopathic community and how they were talking about their definition of fascia, the Foundation of Osteopathic Research and Clinical Endorsement. And they put out a study, a 2024 update on fascia nomenclature. I didn't know that this group was out there trying to define and describe fascia in addition to the people who are engaged in the Fascia Research Society. So that will likely be in an upcoming episode as well. So we can talk about that. So once you go down a rabbit hole, there's a whole lot of different tangents you can take on all this stuff, of course. Okay, so to wrap things up here, I'm going to make my ask. If you found this podcast helpful, I would certainly be grateful if you'd leave some kind of a rating, or comments are always helpful. That just helps it so other practitioners can find this and jump on and maybe learn something that might be helpful in their clinical practice. So here's to advancing practice one fascia-informed step at a time. Thank you so much. Have a great day. You've been listening to the Fascia-Informed Therapist podcast. Be sure to subscribe so you don't miss new episodes. And if you'd like to go deeper, check out my continuing education courses, both online and in person. You can find them at fasciainformed.com. Thanks for listening, and I look forward to next time.